I'm Lou Carta of the Middletown Health Department, and this is Healthline. Having a digestive issue can greatly impact your life. In fact, approximately 60 to 70 million Americans suffer from gastrointestinal problems, leading to nearly 250,000 deaths each year. But solving a digestive problem can be very challenging because there are so many types of gastrointestinal issues that it is often difficult to diagnose them. Nadeem Hussain is here to tell us about the different types of gastrointestinal diseases and how a team approach of specialists can better manage and treat digestive diseases. Welcome to Healthline. Our guest today is Dr. Nadeem Hussain. Dr. Hussain is the Chief of Gastroenterology with Middlesex Hospital. Dr. Hussain, thank you for being here today.
Thank you, Lou, for having me.
And let's talk about what digestive problems there are. Give us an example of what can... Well, first of all, let's talk about the digestive system itself. Explain a little bit about the digestive system for those that may not be familiar with it.
Sure. So the digestive system includes everything that goes from the mouth to the anus. So that includes the areas of the esophagus, stomach, small intestine, colon, or rectum, and even the surrounding organs such as the liver, the pancreas. So you can imagine with all those organs that there can be all kinds of disorders. And in between all that is the small intestine also.
It's quite complex. And
yes, there's so much involved. There's medicine and then the endoscopic portions of the GI tract. So there's a lot to cover there.
So what are some of the common problems that you often see associated with this?
So probably the most common would be the reflux-related symptoms. You know, patients have heartburn, regurgitation, or sometimes swallowing difficulty. That would probably be the number one. And then there's all sorts of other, such as irritable bowel syndrome, where there's cramping and distension and diarrhea, constipation related to that, and then there's other problems such as pancreatic cancer, cysts, pancreatitis, and less common but serious illnesses such as C. difficile, where they're treated initially with antibiotics, and there's bacterial infection of the large intestine that can sometimes be tricky to treat. So for that type of disorder, we'll do stool transplants to treat that, and that's been very successful over the past years.
And going back to IBS, irritable bowel syndrome, it seems to me that we've heard a lot about that lately. It's quite common, so it seems. But maybe 15 years ago, 20, you never heard that. Was this always a problem and somebody identified it? Give me a little history about that.
Oh, sure. So irritable bowel syndrome, it's been around as long as we've been around. It's just that it's a diagnosis of exclusion. So it's one of those problems where if someone's having diarrhea or cramping, we want to make sure that there's no inflammation or ulcers within the GI tract, that the patient's not suffering from Crohn's, for example, or bacterial overgrowth within the small intestine. And as long as all those underlying disorders are excluded, then irritable bowel syndrome basically means that the patient's more sensitive to the air and distension, and that's what results in the cramping and the diarrhea.
And how does that differ for, you mentioned Crohn's disease. What exactly is Crohn's disease?
So with Crohn's disease, that's an autoimmune type of condition where the body is attacking the intestine. Usually it's the small intestine, the large intestine possibly. Even in the mouth, people can get aphthous ulcers. And the way that's confirmed is if we see areas of inflammation, biopsies are taken, and under the microscope, we can see certain signs that would indicate that that's what the diagnosis is. And the reason it makes a difference is if we discover something like that, then we can specifically treat the autoimmune response and help reduce the inflammatory changes there.
Are most of these issues very serious, or is it something that kind of common? You might live with it. I mentioned at the top of the program that there are a large number of deaths each year. But tell me, what do you see in terms of
sure.
that?
So it is a whole range. There are serious conditions such as colon cancer, where the patient may not have any symptoms and present with a tumor, and that's why we recommend screening and routine either colonoscopies or stool testing to be able to capture that before it becomes advanced like that. And then there's milder conditions where it's irritable bowel syndrome or reflux. Someone might be just having mild heartburn. So it is such a broad range. Sure.
What's the success rate of catching something like that when you do early screening or early intervention?
Oh, yes. So for colon cancer, it's actually one of the most preventable cancers. And as long as the patient's having frequent screening and, for the average person who has no risk factors, that would be at the age of 50 and then every 10 years after that. Or even at the age of 45 in certain populations, African American population, there's a higher risk there. And then we're also recommending patients who have a family history to consider hereditary testing. And if we identify a gene or something that places them at higher risk, then we can fine-tune the screening. So it is highly preventable.
And you touched upon my next question, which was, who is there somebody or some group more likely to see some type of a digestive issue? Male, female, you mentioned some of the other groups, but male, female, any difference?
Oh,
between
sure.
that?
Yes, depending on the condition. So irritable bowel syndrome tends to affect females more than males, but it does affect both populations. And then depending on the, if someone has autoimmune history like thyroid problems or diabetes, then they're probably more likely to develop autoimmune type conditions such as Crohn's or autoimmune hepatitis. So yes, it does depend.
Do you think the numbers are going up in terms of the number of Americans that are becoming sick or ill from these type of disorders, or is it better screening that is making the numbers rise?
Oh, sure. Better screening is helping reduce the chance for people to develop certain conditions such as colon cancer. But you're certainly right. With the obesity epidemic and with smoking and alcohol, that's affecting the numbers. For example, smoking and alcohol can irritate the pancreas, and the same with obesity, and the risk of pancreatic cancer may go up because of those risk factors. So that may be the easiest solution to reduce the risk, to quit smoking, quit alcohol, or at least to limit the use.
And as you said, the diet probably plays a big role as well.
Yes.
How about stress or any other factors like that?
Oh, yeah. So it's amazing how stress can affect a lot of these conditions. For example, irritable bowel syndrome, it can be aggravated if someone's having stress at work, and then their GI system gets aggravated, and then that kind of bounces back to increasing the stress. So it's kind of a never-ending cycle, and that's what we're hoping to break.
I've heard that fiber may play some type of role in this as well.
Yes. So fiber can help in many ways. It makes it easier on the intestine to have more fiber in the diet in general. So if someone has a history of diverticulosis, for example, or irritable bowel syndrome, by increasing the fiber in the diet, even hemorrhoids, then that can help reduce the inflammation and irritation there. And oftentimes the symptoms may improve without having to resort to surgery.
Does water consumption play a role too?
Yes, and these days you're right. That's been a problem where we're in such a rush and we're not hydrating as well as we should, and the whole lifestyle part of things. Between the exercise, watching the diet, avoiding prepared and fast foods and frozen foods, all those things play a role.
You're listening to Healthline. Our guest is Dr. Nadeem Hussain, who is the Chief of Gastroenterology with Middlesex Hospital. We're talking about digestive issues and some of the prevention you had just mentioned. Is there anything else you'd like to stress besides dietary intake, water? Is there anything else that people can do to kind of limit the probability of getting one of these disorders?
Well, so probably one of the most important things that, especially over the past several years, has developed is recognizing if there's a family history. So if you know of a family member who had breast cancer or stomach cancer, esophageal cancer, ovarian cancer, melanoma, all those things actually influence your risk of developing even GI tract tumors. So we're hoping to capture that population and make sure that they receive the appropriate counseling and, if needed, genetic testing, which can be done by a simple blood test. And by identifying those populations, then we might be able to do things to prevent.
I find this fascinating that this all connects things you would never associate. I think, at least in my mind, I find it hard to associate. But it's interesting how you make those connections.
Sure, and that's what's been a challenge. 5-10 years ago, people wouldn't even think about the association there. And now that the genetic testing is easier and more accessible, and the insurers are better about covering those type of tests, it's becoming more practical to evaluate those.
Mm-hmm. And at what point should a person decide to see a physician or get some type of help? I mean, sometimes you have some acid reflux, nothing really serious. But at what point do you recommend a person see a physician?
Oh, sure. So if in the example of the reflux, for example, if someone has mild reflux and they have no risk factors and they're under the age of 40 and it gets better just with the Tums, then it may be okay to manage conservatively. Whereas if someone has risk factors, for example, obesity or smoking or alcohol abuse, or if they're over the age of 40, or if the problem isn't easily solved with milder medication like Tums or Pepcid, then it may be time to seek attention. Normally, if someone's over the age of 40, if they're obese, then we'd want to at least have a baseline look at the esophagus and make sure that there's no chronic injury developing. For example, you could develop Barrett's esophagus, which is a precancerous condition. And if we identify that, then we can do things to prevent that from developing further.
And with all these factors that are coming into play, it makes sense that there now is a team approach that Middlesex Health has established, the Center for Digestive Health. Tell us a little bit about that.
Sure. So over the past 15 years, we've really developed the GI program. So now we do endoscopic ultrasound for evaluation of tumors and other benign lesions around the esophagus, for example, the pancreas, the liver, the gallbladder, and also for staging of tumors. We also are capable now of Barrett's ablation. So if we discover precancerous changes there, then we can cauterize them and bring the tissue back to normal again to reduce the risk for esophageal cancer.
And if people want more information about this particular center or about gastrointestinal issues, how can they get a hold of you?
Sure. That can be accessed through our website, middlesex.org/gastroenterology. And also we have a nurse navigator who helps coordinate between patients and providers. So if any of those groups have any questions or need direction, they can reach Stacy at 860-358-2072.
Dr. Nadeem Hussain, thank you for being our guest today on Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.